Sex is an integral part of life, no matter your age. However, as we grow older, our bodies and needs change. It's crucial to adapt and embrace those changes rather than resisting them. There's no reason why intimacy in your later years can't be fulfilling, satisfying, and meaningful. But there are a few things you might be doing that could be hindering your enjoyment or compromising your health. As the body ages, the way we experience intimacy may also evolve, and some behaviors that once felt natural can now be counterproductive. Older adults are often more experienced and knowledgeable about what works for them, but there are still pitfalls to avoid for optimal sexual health. Let's take a look at 7 things that older adults should stop doing in the bedroom in order to ensure a fulfilling, healthy, and safe sex life. 1. Neglecting communication with your partner. In every relationship, communication is key, but it becomes even more crucial in later life. As we age, physical changes such as hormonal shifts or health-related issues may affect how we experience intimacy. Many older adults tend to avoid discussing these changes, either out of embarrassment or the desire to maintain a sense of privacy. However, the lack of communication can lead to confusion, dissatisfaction, and a breakdown in intimacy. It's important to openly talk with your partner about your desires, needs, and concerns. Share any discomfort you may be experiencing, such as pain during intercourse or any new sensations. If you're dealing with issues like erectile dysfunction or vaginal dryness, discuss potential solutions and make it a joint effort to find alternatives. Communicating honestly can help both partners feel more connected and respected, reducing the stress and anxiety that can sometimes accompany physical challenges. Additionally, communication is about more than just the physical aspects of intimacy. It involves discussing emotional needs as well. For many older adults, emotional connection is just as important as physical pleasure. If you need more affection or emotional support from your partner, it's vital to express this. Don't assume your partner knows what you need. Share your thoughts and feelings and encourage them to do the same. 2. Ignoring the importance of foreplay. When we were younger, we may have rushed into sex with little regard for the necessary steps of getting our bodies ready for intimacy. However, as we age, the importance of foreplay becomes even more pronounced. Hormonal shifts, a decrease in libido, and physical changes can result in a slower arousal process, which makes skipping foreplay a mistake. Foreplay helps in many ways. It not only increases physical pleasure, but also strengthens emotional bonds between partners. It's important to remember that foreplay doesn't necessarily have to involve just kissing or touching. It can include any activity that makes you feel more connected and aroused. Slow, sensual touches, extended kissing, and mutual exploration can help you build the anticipation needed to enjoy a fulfilling sexual experience. For older adults, taking the time to engage in extended foreplay can also make up for changes in your body, such as decreased natural lubrication or reduced blood flow to the genital area. This allows you to feel more comfortable, and it ensures both partners are fully engaged in the experience. 3. Not using lubrication. Vaginal dryness and decreased natural lubrication are common problems that many older women experience as they go through menopause and beyond. The drop in estrogen levels can lead to thinning of the vaginal walls, making intercourse uncomfortable or even painful. For men, reduced testosterone can affect erectile function and stamina, which can also impact sexual pleasure. If you are finding that natural lubrication is insufficient, don't hesitate to use an artificial lubricant. It's not a sign of failure, it's simply a tool to help enhance comfort and pleasure. There are various types of lubricants available, including water-based, silicone-based, and oil-based, each suited for different preferences and needs. Water-based lubricants are versatile and work well with most condoms and sex toys, but they may need to be reapplied during longer sessions. Silicone-based lubricants tend to last longer and are great for water play, while oil-based lubricants are perfect for extended sessions, but should not be used with latex condoms. It's essential to explore different options to see what feels best for you and your partner. Using lubrication also improves the experience for men. Lubricants can help reduce friction and support erectile function, ensuring a smoother and more enjoyable experience for both partners. So make sure to incorporate lubrication into your sex life. It's a simple, effective solution to common age-related issues. 4. Forgetting to prioritize safety. While sexual health is often associated with younger adults, older adults are not immune to the risks of sexually transmitted infections, STIs. A common misconception is that as people age, the risk of contracting an STI significantly decreases. However, this simply isn't true, especially for older adults who may be more likely to engage in sexual activity after a period of abstinence or in new relationships. Older adults should continue to use protection during sex, particularly if you have multiple sexual partners or are entering a new relationship. Condoms are the best way to protect against STIs, as well as other concerns like urinary tract infections, UTIs, which are common among older women. Using condoms reduces the risk of infections that can be easily transmitted during intercourse. Regular STI testing is also an important practice, as many infections can go undetected without symptoms. Talk to your healthcare provider about STI testing and ensure you're taking the necessary precautions to protect both yourself and your partner. 5. Trying to recapture your youthful sexuality. The desire to recapture the passion, stamina, and frequency of youth is natural, but it can be detrimental to your self-esteem and sexual satisfaction. As you age, your body undergoes physical changes, and it's essential to acknowledge that your sex life may not look the same as it once did. Comparing your current intimacy to the sexual experiences of your youth may lead to feelings of frustration or disappointment. Instead of focusing on trying to recreate your younger sexual experiences, embrace the new rhythm that comes with age. Enjoy the slower pace, the deeper connection, and the increased emotional intimacy. Sex may become more about connecting with your partner on a deeper level, rather than focusing solely on the physical act. Many older adults find that their sex life in their later years becomes more satisfying because of the emotional maturity and wisdom gained over time. Explore different types of sexual activities and find what works best for you now. It might include sensual massages, oral sex, or even a focus on cuddling and affectionate touch. As your body changes, so too should your approach to intimacy. 6. Avoiding physical or emotional connection. Emotional intimacy is just as important as physical intimacy, especially in older age. If you're in a relationship, it's essential to continue nurturing both your physical connection and emotional bond. As our bodies age, the desire for touch and affection may become even more important. Unfortunately, some older adults may stop expressing affection due to fears of inadequacy or feelings of embarrassment about their aging bodies. Maintaining physical closeness is vital, even if it's not always leading to sexual intercourse. Touch is healing, comforting, and important for emotional well-being. Hold hands, cuddle, and share moments of tenderness with your partner. These gestures strengthen your bond and ensure that you continue feeling connected. In addition to physical touch, make sure to continue investing in the emotional aspects of your relationship. Share experiences, express gratitude, and continue to foster a sense of companionship. Building and maintaining an emotional connection can create a solid foundation for a satisfying and fulfilling sex life, no matter your age. 7. Not seeking help when necessary. Many older adults experience changes in their sexual health, but that doesn't mean you have to suffer in silence. Conditions like erectile dysfunction, ED, vaginal dryness, or loss of libido can affect your ability to enjoy sex, but there are solutions available. Unfortunately, some older adults avoid seeking medical help because they feel embarrassed or believe these issues are just a normal part of aging. The truth is, you don't have to accept sexual health problems as something you just have to live with. If you're experiencing any difficulties, speak to your healthcare provider. There are medications and treatments available for erectile dysfunction, as well as hormone therapy options for women experiencing vaginal dryness. Therapy or counseling may also be helpful for addressing any emotional barriers to intimacy, such as anxiety or depression. Don't hesitate to reach out for help. Your sexual health and well-being are just as important as any other aspect of your health. Embrace your sexuality in your later years. Aging doesn't mean the end of an active or fulfilling sex life. In fact, many people find that their sexual experiences in later years can be even more rewarding than in their younger days. By embracing the changes in your body, staying open to new experiences, and maintaining healthy habits, you can ensure that your intimacy continues to bring joy, connection, and fulfillment. If you're older and sexually active, stop focusing on past experiences or outdated habits. Instead, focus on communication, lubrication, safety, and emotional intimacy. Take care of your body and mind, and don't be afraid to seek help when necessary. Most importantly, remember that your sexuality is still an important part of who you are, and there's no reason why you can't continue to enjoy it well into your later years. By adapting to your body's needs and embracing new ways of connecting with your partner, you can enjoy a rich, satisfying sex life at any age. The key is to approach intimacy with patience, openness, and a willingness to evolve. Your best years in the bedroom are still ahead of you. Enjoy them to the fullest.